Thank you so much for having me today. I'm Hillary Baca, and I work at National Jewish Health, so we are the vendor for the Colorado QuitLine. So today I'm going to go over kind of some process-related things, just tell you what a typical experience is, because you're all out there in the community. That's the number one thing we're asked. What is it like when you call the QuitLine? Some technology things that we're working on for this year and next year, and then I would love to have any questions that you have for me. Okay, so first of all, this is our 10-year anniversary. As of December of 2012, we are celebrating 10 years being the vendor for the Colorado QuitLine. So we both kind of launched this effort together. The state of Colorado was our very first client. We now have, as you'll see, we have 11 states that we work with, and then many health plans and corporations. So just a little bit about National Jewish. We have been around a very long time, since 1899. So we started actually as a refuge for tuberculosis patients. So our roots are in respiratory care, and that's kind of how we've carried things forward. We've actually been the #1 respiratory hospital in America since '98 straight. So we're really, really proud of that. So what we focus on in our Health Initiatives Division, which runs the QuitLine, is actually the #1 and 2 causes of preventable death today. So that's smoking, which has been around the longest, or tobacco use. And then about 6 years ago, we launched a weight management program as well. So, all right, so as I was mentioning earlier, we provide our QuitLine services for 11 states. And the ones in dark blue are some of them. We actually were just awarded the North Dakota contract, so we're super excited about that. And then the other states in blue, and really all over the country, we're serving employees of different employer groups and health plans. So we're pretty much covering everywhere. We have provided, we're actually up to almost 800,000 now of providing intakes or QuitLine services. And over a $250,000 of those are from just Colorado alone. So we're happy about those numbers, and they'll keep going up for sure. So a little bit about our program. Everything that we do is guided by the National Jewish expertise. So 60% of what we do at our hospital is research. So that all ties into our program. So everything that the docs look at there helps guide our program. We have 40 years of experience in call lines. So we started with, we used to do a disease management program. We have the lung line, nurse line. So while we've been doing the QuitLine for only 10 years, we've had other lines going a lot longer than that. So the major components of our program here are telephonic counseling. We offer nicotine replacement therapy for most of our clients. We work with each participant on relapse prevention, problem-solving skill training, social support. One thing that's really important is that we treat all of our participants as unique individuals. We are not scripted. We really want to meet people where they're at in this process. We don't want to, it's not a one-size-fits-all program by any means. So our primary emphasis is on motivational interviewing, and some of you may or may not be familiar with that. I have a slide later to kind of show you a little bit about that. And then we offer online and text messaging support for the participants right now. So this is kind of an idea. We work off of the stages of change process. So again, depending on the participant, we get people that are all over the spectrum coming into our program. We get people that are not ready to quit, they're not even close, and we work with them to help set a quit date, and we hope that by the time we're through a few calls, they're finally ready to do that. And then we get people that they're ready to go. They want to set a quit date immediately, get NRT. Some people have already quit, so we have a wide range of people coming through this process, and then, some people can drop back into a different category when they come back through. So our staff, a little bit about our staff. All of our coaches at the QuitLine have a bachelor's degree at minimum in social sciences or equivalent work experience. So we have a lot of people that are in grad school. We have a couple of folks that have actually been with us this whole time, and they're in their 50s and 60s, and this is just what they have a passion for. And that's who we want to get into the QuitLine. That's who we want counseling these folks. We offer a 4-week training curriculum that talks, motivational interviewing, priority populations, systems, all that kind of stuff. And then at the end, we put them through a pretty rigorous test to make sure that they're truly ready. They have to shadow people on the floor. So 4 weeks is really just classroom work, and then we have to see how they do on the phones. So we make sure we get the right people out there. And then continuing education. Once a month, our trainer actually does continuing education with all sorts of topics. We've had certain clients send out like people from their Native American communities and train our staff. We've had LGBT training, mental health training, MI training constantly, obviously, just so they can refresh on that pregnancy and postpartum training. So that's something that we do every month. And a little bit about the partnership that's been going on since 2010. So as you all may know, the STEP program kind of lost their funding levels a couple years ago. So it was critical to reach out to the community, to all the health plans, and try to get them to pick up the bill for their members that are coming through the QuitLine. So this was critical to make sure that people that were calling the QuitLine still got some level of service. Now, these health plans, they don't cover everybody except for Kaiser and Anthem are really the shining examples at this point. Every single person that tells us they have Kaiser will get through the QuitLine, no problem. Some of these others will deny like their ASO plans and things like that, but the bottom line is that the Colorado QuitLine will still cover it. They'll pick up the difference right now because they did get their funding levels back. And then we have two at the bottom here, so Cigna and Humana. They require us to actually warm transfer back to them, and because they have their own program in some way, shape, or form. A lot of those people actually come back to us saying that they weren't eligible for that program, or we've heard things such as they're being sent a relaxation CD for smoking cessation. So we'll get a lot of those people back through the QuitLine, but that's the process. As of right now, we still have to at least try to warm transfer those folks. The rest of them, they just come through the QuitLine. They don't know any different, but we bill the services back to that insurance provider. So, go ahead. So a little bit about eligibility for the Colorado QuitLine. As I mentioned, it's important to know that right now, because Colorado did get their funding back, everybody is eligible for the QuitLine. We're not turning people away right now, which is wonderful. So at the beginning of the intake, we have a short eligibility process that is going to ask each caller about their insurance provider, so we can code it properly and bill it to the right place. You know, again, that's what that's for. It doesn't mean that we're going to turn you away if you tell us something particular. So, and again, that helps sustain funding for the Colorado QuitLine, being able to bill out those members. I mean, Kaiser's the biggest one. We get at least a couple hundred of their members coming through the QuitLine every month. So, and the caller really needs to have, you know, if you're out there telling people about what they need to be prepared for, they really need to have their member ID with them or their insurance card. That really helps us. Again, we're not going to turn them away if they're missing that, but it's just very helpful for us to have that, or else we can't bill it to the health plan. And then again, every caller is eligible to receive services, every state resident. So if we have somebody outside of the state, they are not eligible for services. Yes?
What if they don't have insurance?
They're absolutely eligible. We just code them as no insurance and we're good to go. Again, it's just information collecting. So, you know, Medicaid, Medicare. Medicare, I believe a lot of people's ID is like their social security number, so we don't typically collect that. We don't want their social security number. So there are a few different ways that participants can enroll in the QuitLine. Obviously, the one that's most well known is 1-800-QUIT-NOW. They can give us a call. They can be fax referred by their healthcare provider or health educator. We don't discriminate on who we accept fax referrals from. Anybody can send them to us. It's just what I'll go over later is who we can send updates to. That's just healthcare providers. So, and then they can also enroll online at coquitline.org. So there's an online enrollment form. They can choose to stay online only. They can do an online and phone program. So those are the different ways they can come in. We are actually open 7 days a week, 6 a.m. to 11 p.m. Mountain Standard Time. So we cover a lot of hours. Outside of those hours, we have recorded quit tips. They can leave us a voicemail. We'll call back within 24 hours. And we are, of course, bilingual. 20% of our staff speaks English and Spanish. So. And then the program is a 5-call program. So what that means is there's an intake call that happens at the beginning and then 5 coaching calls after that. Those are scheduled. We will call the participant for their scheduled call. But outside of that, if they need support in between their coaching calls, after the 5 calls are over, they can call us an unlimited amount of times for support. Typically, we don't see that a lot. The average is about 3.5 coaching calls for each participant, but we do have those that sort of overutilize the QuitLine. We have folks that do 40 coaching calls with us. So for various reasons. Obviously, 60% of who we're serving right now are people that are identifying with a mental health condition. So those are typically the folks that we see with all the coaching calls. So what can participants expect when they call into the QuitLine? We have 2 sets of staff. So our smaller amount is a CSR. They do an intake only. They don't do coaching. And then we have the coaches who can do both. So typically those incoming calls are going to be answered by a CSR. The intake will last approximately 10 to 12 minutes. That's a lot of demographic questions that we have to ask for many reasons. There is what's called the minimal data set that all the state QuitLines kind of try to conform to, and it basically provides for reporting back to the CDC, to the North American QuitLine Consortium, so QuitLines can be compared across the country. So that's the main reason why we ask all that, and also so they know how we're doing with different focus populations. Maybe you're doing an outreach to diabetics, and so we'll know based on the numbers if that's working. So after that intake's done, the CSR is going to transfer the call immediately, hopefully, right over to the coach so the first coaching call can be performed. If the participant doesn't have time for that, or let's say we're experiencing extremely high call volumes, that coaching call will be scheduled for another day. But it's usually pretty quick, usually within a few days. And then we just tell every participant, look for that's basically the number for 1-800-QUIT-NOW. That's what's going to show up on their caller ID. A lot of people ignore 800 numbers that come through. So, go ahead. And then this is just kind of an idea. Again, every participant's different. It takes every person a different amount of time to get through the program, but typically, I guess on average, we see about a 60-day time period for people to come through our program. So, again, day 1, participant calls the QuitLine, or they come in through another form. We'll do the intake and hopefully the first of 5 coaching calls. After they have that first enrollment or intake session, we send them a welcome packet. So it has, we have a smoking cessation guide, and based on answers to demographic questions, we have some materials for special populations available too. So, and then we give them a welcome letter. If it's a support person, they have special letters that go out to them. So, and then over the next, again, 6 to 8 weeks, typically we'll conduct those extra 4 coaching calls for the participants. And they can call us at any time for support, or log on to the website and get information. After those 5 calls are completed, or let's say at 4 coaching calls they're doing really well and they are quit, we will send them a completion certificate. A lot of them use that to show their employer or their insurance provider if they're being charged extra premiums or a surcharge. So, currently, the Colorado QuitLine is offering patches and gum. We partner with one of the GlaxoSmithKline distributors, so we are offering the name brand products right now. So there are several different flavors of the gum and, of course, the patch available. I believe in next fiscal year, they're possibly going to be adding the lozenge as well. So we medically screen all participants, and if somebody identifies that they have, this is based on the labeling on the NRT package, if somebody's pregnant, breastfeeding, they have a heart condition, or they have high blood pressure that's not controlled by meds, then we have to get a physician consent signed to ship NRT. So, and those are shipped directly to the participant's home. This is an idea, just the next 2 slides are kind of examples of the materials that we send out. So, and then we have them in Spanish as well. The fax referral program, you can get the form online at coquitline.org. Colorado has it on their, I believe, CO Health Resources, their various websites, they have it available. And once we receive that referral form, we make that outbound call within 24 hours to the participant. And then if they give us specific times that they would like to be contacted, from there we contact them at those preferred times. If not, we call them at 3 days and then at 10 more days from there. So we're making a total of 3 attempts to reach every fax referral. And then, as I was mentioning earlier, if we have somebody that sent us a fax referral that actually is a healthcare provider and a HIPAA-covered entity, we will send them faxes back to let them know the progress of their patient through the QuitLine. So, and just so you all know, I mean, typically we're seeing of all the fax referrals we get like 600 a month approximately for the state of Colorado. And typically only about 30% or so of those folks end up enrolling in the QuitLine. So we have a very high rate of unreachable folks. We're never able to get them on the phone. So that's the biggest percentage. Great. And that's just a picture of the form. So the most important things to make sure that are collected on the form, we need the physician information. So again, we can get them those updates back. And we can fax them the MD consent if we need to, that kind of thing. The participant information and signature obviously is critical, or else we cannot contact them. And the signature is really for, they're giving us permission to contact them. Otherwise, we're not able to do that. We're not legally able to call them. So let's see. The next thing I wanted to talk about is our pregnancy protocol. So some of you may or may not be aware of this. It's been going on for a couple years. We collaborated with the state of Colorado and designed this pregnancy protocol because this was a population that had extremely low quit rates and rates of relapse. So the way we've designed it here is that it's 9 coaching calls over pregnancy and postpartum. So 5 calls typically occur during pregnancy and then up to 4 postpartum. And we actually follow them up to a year postpartum. So again, one of those things, we say it's a 9-call program, but it's actually unlimited support if they need it. So you have to be pregnant in order to enroll in this particular program. If they've already had their baby, they would just go through the regular program. We send them special text messages. We give them the same coach throughout the whole program, and we've heard that that's really been the, they've raved the most about having the same female coach. So they get to talk to the same person at every call. The general QuitLine, they could really get a different coach anytime unless they request something different. So, and then we send incentives for each call. So we send little like MasterCard gift cards, $5 for each pregnancy call, and then $10 for each postpartum call. So it may seem like not a whole lot, but to these women, to a lot of the women that come through this program, it's a big deal. It's a couple packs of diapers or formula or whatever it is. So. And then we've seen wonderful results from this program thus far. We've had several other states sign up for it in the past few months since the pilot's been over. So we'll have some even better results with a bigger population, but this is what we've seen so far, and that's just phenomenal for this population. 55.2% quit rate at the end of pregnancy, and following that out even 7 months postpartum, they're almost 50%. So we love to share this. Actually, the CDPHE gave us this from their website. This woman actually went through the QuitLine, and she's just saying here that perfect little life supported by the Colorado QuitLine, and she's thanking the coach Michelle for helping her deliver a healthy baby. So, all right, and then next I just wanted to go over the online resources available. This is kind of a bad screenshot of it, but this is the homepage of the website. There are links to the CDC Tips for Former Smokers, the media campaign that's currently running, their Facebook page, Twitter. So there's a lot of resources on this website. This is kind of an overview of what goes on the website. So it's completely linked up with our case management system. So if we have somebody that enrolls online, we can actually view their data. Our coaches on the phone can view the data. So they can see how many times that person's logged in. We have full visibility, so it's just nice to be able to fix things on either end. So we can set or edit the quit date online or in our system, track tobacco use, track quit progress. It shows them little charts on how they're doing. One of the things that people love is that now online they can track their NRT orders. This little picture down below is what they can view online. So instead of calling the coach to see where's my NRT, they can look up the tracking number and they'll have a link to that. So, and they have e-lessons, worksheets, goals, journals, chats and forums, and then we'll be adding mobile apps at probably late summer this year. So, great. And then here are some of the things that the state of Colorado added this year. So we started text messaging in October of this year for participants, and that was the program that we started out with. Appointment reminders, like 20 different motivational messages that go out, all sorts of different things going on, but we actually, as of the end of this month, are completely changing that up. So our clinical director looked at the smokefree.gov text and kind of integrated that with our program. So it's kind of a mixture of the two, and people can get up to 1 text message a day for, I think, a year. It goes out a year and follows these folks and tries to re-engage them several months down the road. So we're excited to get those results to see how that's going to work. So, and again, appointment reminders. E-Coach is what I just explained. That's the whole idea of the integration between our case management system and the website and the chats and everything. And Colorado just added the chronic disease screening. So they are sending out mailings to folks that identify with a few different conditions such as diabetes, hypertension. Now I'm forgetting the third one. But those people that identify that way are getting mailings, they're getting referrals out to additional resources. So, and then they're hoping to kind of model that. They're hoping to do sort of the same thing with behavioral health, but that's sort of under construction right now. And then e-referral. Some of you may know that Denver Health was awarded a grant from CDPHE to work on the e-referral aspect, so that's being actively worked on, and we're hoping that within the next year we'll have that going to where our system can talk to EMRs and we get rid of paper, basically. So reporting, this is something people are very interested in. We had a call, STEP had a call yesterday about reporting. So I send STEP reports weekly and monthly that gives them an idea of volume, the demographics, all sorts of different things, as you can see here. Starting, I think they're going to post in the next couple weeks. We've started pulling regional level, so by the health districts basically, and those will be posted on their website at CoPrevent. So you'll be able to see what kind of numbers your communities are putting up in terms of demographics, call volume. So you'll be able to see, based on the media that El Paso is running, what that's doing to the call volume specifically for El Paso County. So, and then any special reporting requests, we get these a lot from all the different grantees. They just ask that you run those through Tom Valland at STEP, and then he can come to us and we'll get the reporting that you need if we can do it. So, and if any of you have any questions, please feel free to take down my information, call me anytime. We would prefer that you don't call 1-800-QUIT-NOW, just because we want to keep the phone lines open, especially during this mass media campaign that's running right now from the CDC. And I can answer any questions that you have, for sure. So.